Blood circulation blockage. The mind gets about 25% of the body's oxygen but cannot hold it. Brain cells need a continuous oxygen supply to remain healthy and function properly. Therefore, blood needs to be provided regularly to the brain through two primary arterial devices. The two primary arterial devices that provide blood to the brain are 1. Carotid arteries. The carotid arteries are major blood vessels located on each side of the neck. There are two carotid arteries, the right carotid artery and the left carotid artery. They supply blood to the brain, face, and neck. The common carotid artery branches into two smaller arteries. The internal carotid artery, which supplies blood to the brain, and the external carotid artery, which supplies blood to the face and neck. 2. Vertebral arteries. The vertebral arteries are a pair of arteries that run up the back of the neck and enter the skull through the foramen magnum, a large opening at the base of the skull. They join together inside the skull to form the basilar artery, which supplies blood to the brainstem and the posterior part of the brain. It's important to ensure that these arteries are not blocked or constricted, as it can lead to reduced blood flow and oxygen supply to the brain, potentially causing various health issues, including stroke or ischemic attack. If you suspect any problems with blood circulation or blockages, it's crucial to consult a healthcare professional for proper evaluation and treatment. A reduction of, or disruption in, blood flow to the brain is the cause of a stroke. Blockage for even a short period can be disastrous and cause brain damage or even death. A reduction or interruption of blood flow to the brain is indeed the underlying cause of a stroke. Strokes occur when there is a blockage or rupture of a blood vessel supplying the brain, leading to the deprivation of oxygen and nutrients to brain cells. There are two main types of strokes. 1. Ischemic stroke. This type of stroke occurs when a blood clot or other debris blocks a blood vessel supplying the brain. The blockage prevents blood flow, resulting in the lack of oxygen and nutrients to brain cells in the affected area. 2. Hemorrhagic stroke. This type of stroke occurs when a blood vessel in the brain ruptures, causing bleeding into or around the brain. The leaked blood puts pressure on brain tissue, leading to damage and disruption of normal brain function. Both types of strokes can cause severe brain damage or even be life-threatening, depending on the extent and duration of the blockage or bleeding. Immediate medical attention is crucial in stroke cases to minimize brain damage and improve chances of recovery. Recognizing the signs and symptoms of a stroke, such as sudden weakness or numbness on one side of the body, difficulty speaking, severe headache, and loss of coordination, is important in order to seek emergency medical assistance promptly. To help prevent strokes and maintain good brain health, here are some steps you can take. 1. Maintain a healthy lifestyle. Follow a balanced diet. Eat a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit your intake of saturated and trans fats, sodium, and added sugars. Exercise regularly. Engage in moderate-intensity aerobic exercise for at least 150 minutes per week, along with strength training exercises twice a week. Maintain a healthy weight. Keep your body mass index, BMI, within the recommended range for your height and age. Avoid smoking. Smoking significantly increases the risk of stroke. If you smoke, seek help to quit. 2. Manage medical conditions. Control high blood pressure. Monitor your blood pressure regularly and take steps to manage it within a healthy range. Manage diabetes. Keep your blood sugar levels under control through medication, diet, and exercise. Control cholesterol levels. Follow a heart-healthy diet, exercise regularly, and take prescribed medications if necessary to manage high cholesterol. Treat atrial fibrillation. If you have atrial fibrillation, an irregular heartbeat, work with your healthcare provider to manage it effectively, as it increases the risk of blood clots and stroke. 3. Be aware of warning signs and seek prompt medical attention. Learn to recognize the signs and symptoms of a stroke, such as sudden weakness or numbness on one side of the body. Difficulty speaking or understanding speech, severe headache, and loss of coordination or balance. If you or someone else experiences these symptoms, call emergency services immediately. 4. Regular medical checkups. Schedule regular checkups with your healthcare provider to monitor your overall health. Blood pressure, cholesterol levels, and other risk factors for stroke. It's important to remember that prevention is key, and by adopting a healthy lifestyle and managing any underlying medical conditions, you can significantly reduce the risk of stroke. Consult with your healthcare provider for personalized advice and guidance on stroke prevention based on your individual health profile. Matthew, cancer and stroke survivor.